Let's have some fun. This is a hypothetical
Yes,
case.
hypothetical cases. Hypothetical cases.
That's right. So let's call two brothers. We got Tim and John.
All right. So how old are they?
Both of them are 25 and 22 years old. Tim is
25
older.
and 22. Okay. And they
25
live in
and
the
20
same house?
Live in the same house.
All right. Do they like each other?
Most of the time.
All right.
But like
got it.
brothers.
Okay,
You
yeah,
know,
understood.
Like brothers and all brothers. You know, sometimes one person may say something the other one doesn't like.
Understood.
So Tim in this case is big brother, and John is going to be little brother.
Okay.
Right.
Okay, so they get into it, okay, and John decides to hit Tim, and he hits him right in the eye, just one time, right? You just have to tell him once this day, and you know, and so Tim comes in to your facility, Kim, and he's like, "Man, my brother hit me in the eye. What are some of the things I want you to start thinking about? Let's talk this thing through."
Fracture.
You're thinking fracture. So you want to evaluate for a fracture. And how do you want to evaluate for a fracture in this case?
I would do like extraocular motor movement.
Good.
Just make sure there's no entrapment of the muscle.
Look at her. Did you just pull out entrapment?
She did.
Okay,
She did.
this is
She
impressive.
did. She
Are
knows
y'all
her stuff.
learning that already?
Yeah, we learned it in our ENT section.
So
for
why don't you tell us what entrapment is, if you don't mind? Put me on the spot.
So when you have like a fracture,
Mm-hmm.
the muscle or like the nerve can get trapped in between the two bones.
Fracture
or-
line.
Yeah.
That's right.
So the eye can like kind of teardrop into the
Fracture or not even move.
yeah.
That's huge.
That's huge. So that's on your physical exam.
Strong
So you
one,
want to
Kim.
do your physical exam before you start imaging.
Kim's coming out swinging.
Oh, yeah.
That's pretty
Oh,
impressive.
yeah. Kim knows her stuff, man.
Yeah, I'm like the brother.
I was gonna say. Good
Don't
Kim,
mess
good
with John
Kim.
here. So Tim now he's moving his eye, but he's like, it really hurts when I look up. And let's say it's been 2 or 3 hours before you actually get a chance to evaluate him. So now it's red around his eyes. It's he got bloodshot eyes or subconjunctival hemorrhage. And how do you get him to open his eye? He's really swollen. He don't want to open his eye.
I think I'm gonna have to open it for him.
You have to open it for him,
Yeah.
correct. So many times I'll see where the provider doesn't force the exam because it's hurting, because maybe the patient is upset, it could be intoxicated. In this case, he's not. But I don't want to relax on the physical exam portion of the exam because that's very important. You cannot define entrapment without a physical exam.
Yes.
Many times you'll get some imaging, you'll see a muscle trapped in there, or you see the teardrop sign we were talking about. But that does not give you a good excuse not to do a good full physical exam. So I want to touch on that.
Isn't that the nature though? Isn't that all of us though? It's like none of us want to inflict pain on our patient.
That's right.
We're feeling it for them, but it's like, I'm really sorry. Like for me, like when I pack a nose, I like preface it with, this is going to be uncomfortable.
That's right.
And I'm sorry
That's
before
right.
I even do it.
That's right.
Yeah.
That's
Yeah.
right. That's right. But you're there to help.
Yeah, 100%.
Right. So when you have to hold his eyelids open and make him move, it's gonna hurt. All right. Let's say he can't move his eyes. So now you're thinking
Yeah.
entrapment.
Entrapment.
Right? So now that goes from, Tony or Dr. Dennis, we got a guy who's, you can see him in clinic tomorrow or a couple days to, hey, doc, he's entrapped. What would you like to do at this point? Because now you're kind of kicking up that urgency of when I need to see him or when any facial trauma surgeon needs to see him.
Yeah. Would you want me to do like any scans before I call you?
Absolutely. Yes. I do want you to get a CT scan. Many times we talk about plain films. And I think plain films, it has a role.
They have a place.
They have a place.
Sure.
However, in facial trauma with the bones being very small, you can see a fracture maybe on your plain films, but I prefer a CT scan. It helps me with surgical planning. And now we have the capabilities to do 3D reconstruction.
Which is incredible.
You can show the patients the fracture in layman's term. And I think they appreciate that. Where they're not just looking at a random fracture or someone else's fracture or a cartoon of a fracture that you pull up on a computer. They're actually seeing their face in something that they can understand.
That's huge.
Because the 3D models are very much in layman's terms. So you can show them, hey, this is where your fracture is. Now let's talk about observation or repair.
Yeah.
So I prefer CT.
CT. So
scan.
question for you. So CT maxillofacial.
Yes, sir.
And do you? I know the answer, but I'm
Yeah.
with or without contrast.
Without
right?
contrast.
Yeah.
We
Always
don't-
without.
Without contrast. We don't need contrast for the facial trauma.
And I think it's good. We go over this in our course. Like, so there's like 95 to 98% of the time as ENTs, or if you're working up a neck mass or an abscess or something like that in the neck, you want CT contrast. CT of the neck with contrast, okay? The only times we order CT without is maybe like for stones in the salivary gland
Right.
ducts and stuff. But trauma, it's always without
That's
contrast.
right.
Okay.
Right.
It's good to know that.
That's very true. So in this case, let's say he does not have entrapment. So you get a CT scan and you see an orbital floor fracture. And the radiologist reads it as a small orbital floor fracture. And there's no entrapment. So now you're thinking, hey, how do we manage this guy? Let's talk about no sneezing with your mouth closed. Try not to heavy lift and strain. Try not to blow your nose.
Yeah.
Things like that, nice and gentle. And follow up with your facial trauma guide.
So you're saying this is no entrapment?
This is no entrapment.
Okay, gotcha.
This is
Gotcha.
no entrapment. This is the
Easy, straightforward.
straightforward guy.
Okay.
He's getting out of your annex, right? Or your facility, your urgent care, or the emergency department, wherever you are. However, just something's not right, right? He starts to complain, and as you're giving him his discharge papers in this scenario, he starts to yawn, and he's like, "Oh, doc, I'm tired." And you look at the vitals, right? You want to check vitals, and before this, your last vitals, say the heart rate is 80, blood pressure is 130 over 80,
Okay.
and so you check vitals, and now the vitals are 40, heart rate is 40,
Heart rate's 40.
heart rate is 40. So from 80s to 40, right?
Yeah.
Sounds weird, huh?
He's bradying down a little.
He's bradying on you, right? So he's getting more fatigue, and you see
And there's no bleeding on the CT scan.
no bleeding anywhere, no bleeding out.
Yeah.
And all he has is a punch to the face from his brother. That's the only trauma we have. He's totally healthy. Medical history is fine. No
How's
past surgical history.
Blood pressure.
Blood pressure is beginning to go down as well. So the blood pressure, your last check 15 minutes ago was 130 over 80. Now your blood pressure is, let's call it 90 over 40.
Oh, wow.
So a significant drop.
Okay.
And not only is a significant drop by numbers, he's symptomatic.
Okay.
Okay. So tell me what some of the things you're starting to think about. You don't expect this.
Yeah.
Right? He's not entrapped.
Yeah.
You think it's all good. You know, it's a small fracture.
Yeah.
No big deal. You've seen it before.
Yeah.
Sure.
But this one is different.
I mean, I'm thinking parasympathetic response at this point.
Parasympathetic.
Look at you.
Look at that.
That's so. Yeah, please do.
Ooh.
That's impressive.
I mean, when you have like your vagus nerve,
That's right.
so if it's going to the heart, it's slowing down your heart rate. Maybe vasodilate on the vasculature, so that's
True.
going to cause your BP to drop. I mean, I can tell you, I don't know why he would be bradying like that, but
But strong work. But you picked it up. He's
So-
bradying down, and his heart rate's going down, and his blood pressure's going down. Things are dilating, things are slowing down.
yeah,
Yeah, absolutely correct, Kim. So this is another instance where you take something that's simple, and all of a sudden you start to see a shift where it goes from something urgent to emergent.
yeah,
Because you just can't let this guy Brady down, send him home, and say good luck, right? So now it's time to call in ED doc, get him, if you're at a rural area, get him to the emergency department, and let's get some help.
yeah.
So in this case, what I'm presenting is a little bit of ocular cardiac reflex, or the trigeminal reflex.
I haven't heard that since residency.
That's right,
That's
man.
incredible.
So I see it when I'm operating on
Okay.
the orbital floor.
Okay, when you push on it,
when I'm
maybe?
pushing on the orbit and picking up the orbit, I'm picking up the globe, I should say. When I'm fixing the floor, sometimes I'll squeeze a little bit too hard as I'm going deeper into the floor, and the anesthesiologist, you know, they don't really know the reflex either, but they're looking at their monitors and they're like, hey, what's going on?
What's going on? What you doing?
What you doing? Exactly. That's the question there. What are you doing?
Yeah.
What are you doing?
And
You pushing on that eye?
Right, and I know to just let the eye go.
Okay.
It's a pressure from the rectus nerve. The rectus muscle, and pushing on the globe
Okay.
that can cause this.
Wow.
That makes
So that's okay. Because I was even thinking, okay, bradying down, are we thinking hematoma, subdural
Yeah.
hematoma? I guess you gotta, but that's great. You know, I got a quick story.
Because you just scanned him.
You just scanned him.
And the scan only shows an orbital floor fracture. That's it. He has no other injury. So that's
so good.
how I want to present
While
that.
I love that because it just triggered something. You know, patients that come in with posterior nosebleeds,
Mm-hmm.
we pack their nasopharynx, right? Oftentimes, I mean, not the nasopharynx, but we're doing a posterior pack, especially sometimes you have to do it on both sides.
That's right.
And those patients we admit to the hospital because there's a reflex in the nasopharynx that can also cause them to braiding down.
That's
I did
correct.
pituitary surgery on a patient had a big balloon in their nasopharynx and it was putting pressure up against the sphenoid sinus, up against the nasopharynx. And the ICU nurse was calling me. They're like, she's having these symptoms. She's braiding down. She's becoming hypotensive. And it took me a while, like while I'm on the phone, I'm like, oh, let's deflate the balloon.
Yeah, that's right.
Let's
that's
deflate
right.
the balloon.
Take the pressure off.
Yeah.
Take the pressure off.
And that's so in surgery, of course, I just let the eye go.
Yeah.
And I'll tell the anesthesiologist, and most of them know when they're working with me already. Hey, just watch your vitals,
Okay.
and if something goes on, let me know. And it's so
Yes.
easy. But when you're in an urgent care facility or an emergency department, well, you can't let the eye go. You don't have it in the
Yeah.
first place. It's the fracture itself. It's the
Causing the
trauma
problem.
itself causing a problem. So now you want to make that phone call.
That's an emergency now.
It's an
Yeah.
emergency.
Yeah, at this point, it's an emergency.
Correct.
Okay.
Correct. You want to relieve that globe, that rectus muscle as fast as you can. And there are things you can do like atropine. Again, this
Sure.
is an ICU.
Sure.
This is,
Understood.
we're not going to
Understood.
get into that management. The true way to help that person is surgery.
Okay, super. All right, that's definitely a zebra, but a super valuable comment.
Yeah.
Just something to keep
I
your
love
mind
that.
on.
I love that. For more content like this, please like or subscribe to our YouTube channel. Thank you.